My name is Rex Cooksey, born and raised here in Ashland, Kentucky in Westwood. I'm a pretty active person, coaching for over 50 years, playing golf 5 to 6 times a week. And last fall, about October, November, I was feeling fatigued, tired. I thought it was just age, turned 70. And through a friendship at the country club, a couple of my friends recommended that I follow up on this, and they recommended Dr. Friday. And she met with me and put me through the test, and I got them back early in January. And I think on January the 20th, she recommended I go have a stent, or possible stent, and they found blockage.
The calcium screening test is sort of like a mammogram or having a colonoscopy for your heart. Basically, you're looking to see whether you are even at risk. The test for a calcium screening score is actually quite straightforward. You know, there's no dye used, no needles, there's no treadmill. Patients may not even need to change from their street clothes. They just lie on a table. You may have to hold your breath for about 10 seconds. Test takes about 5 minutes, and then the radiologist is able to look at the CAT scan results and look at the plaque buildup that is in your arteries and give you a calcium score.
They hooked me up with the monitor in a CT scan test. I don't think I was in there over 5 or 10 minutes. So it's well worth your time, you know, to make sure everything is right.
When we look at the calcium score screening, we're looking at 2 numbers. There's the Agatston score, which is a score from 0 to thousands. And a score of 0 really is a perfect score. If you have a score of 0, then that means that you're doing fairly well. However, if your score is 1 to 99, that puts you at mild risk of coronary artery disease. And it's sort of a wake-up call. You need to do lifestyle changes, you know, look at your risk factors and adjust them. So if your score is between 100 and 399, that puts you in the moderate range. And that means you have moderate plaque possibly in your coronary arteries. And that is a wake-up call. That means that you need to be looking at all of your risk factors, adjusting them, and knowing what your risk factors are: diabetes, hypertension, high cholesterol, and certainly if you're a smoker. In addition to that, your physician may choose to put you on a statin, especially if your low density lipoprotein is above what the guidelines suggest at this level. If your score is in the 400 range, you may have severe coronary artery disease. If you're not having any symptoms, again, we have to address risk factors very strictly, and also medical management at this point in time. The second number to look at is the percentile. So if you get a score of 75th percentile, that means that your calcium buildup in your arteries is 75% higher than your other people, your age, sex, and background. And this, again, is also a wake-up call that you're doing more poorly than people your age, sex, and background.
I should have kind of maybe known, because my mother and my father's past history with some heart issues. I'm always on the go. I thought, you know, just normal kind of getting 70, you're fatigued, but that really wasn't like me. Went through the cath lab up there, and I found the blockage, and I was back in my room within 50 minutes. And coloring was better, and energy was better. I'm back playing golf, I'm back coaching. You know, I was back, matter of fact, after that process, I was back on the sidelines the next day. You know, my son's the head coach at Russell, and I serve as an assistant, volunteer. You know, everybody was concerned. I said, no concern, I feel good. So it was a quick turnaround, and back playing golf 5 or 6 days a week now, chasing grandkids on baseball and t-ball and softball fields. You know, I'm probably as healthy as I've been in 15 years.
We offer this test at UK King's Daughters at 3 sites. We have them in Paintsville, Ashland, and Portsmouth. We do have to pay a nominal fee for this, about $80, and that is because insurance doesn't cover this. The guidelines suggest that if you between the age of 40 and 75 and you're just wanting to know what your risk of heart disease is, that you can go ahead and have this test. If you want to have one of these tests, you just need to talk to your primary care provider or your cardiologist, and they can put in an order for this test. But it's important to have that feedback with either your primary care physician or your cardiologist about the results so that you know the steps forward once you know whether you're at low risk, moderate risk, or high risk.
Anybody that has any type of questions at all, I wouldn't hesitate. You know, and anybody I run into that asks me about it, you know, I'm going to recommend going through the process.